Welcome to the Equine Vet Connect podcast. I'm your host, Dan Carter. I'm a veterinarian and a farrier. The goal of this podcast is to educate horse people, break things down, bust myths, and keep it real. Speaking of breaking things down, here's my legal disclaimer to keep my attorney and insurance company happy. While I am a vet, I may not be your vet. Contact them before trying anything you hear on this podcast. Remember, just because you watched it on YouTube or heard it on a podcast does not mean you can do it. Please use common sense. Welcome back to the Equine Vet Connect podcast here at Countryside Equine Hospital. Got Dr. Brown with me this morning.
Morning.
So how are you today?
I'm great.
You know, a lot of people film these podcasts and they never say like what time of day it is, but you know what? We do these in the morning.
It is very dark.
Yes, it is a
very
beautiful
rainy.
morning. We get here early. We do these podcasts because that's when our brain works the best. So if you wonder what we do on Friday mornings,
That's what we're
we
here.
film podcasts.
Yeah, we've tried the afternoon podcast and it doesn't work.
No, it does not.
Our brains are too scrambled from the day, and
Yeah. Ooh, it can get rough out there.
we're just stumbling over words and rambling and.
Well, speaking of getting rough, actually, that's a terrible segue.
That was a bad segue. It's okay. You can't win them all. So
You know, it's going to happen. Today, we're going to talk about one of my favorite topics. I probably, there's not a day that goes by I don't talk about this. We're going to talk about vitamin E.
Vitamin E, vitamin excellent,
Ooh, I like that.
vitamin excellent.
E for excellent. So, this is probably one, you know, we talk about nutrients. This is in that micronutrient category.
Yes.
We got macronutrients. That's your carbohydrates, your fats, your proteins, water. Then you get your micronutrients. That's your vitamins and minerals. And I'm going to put this right up there at the top of micronutrients for the horse. So today, deep dive, vitamin E.
Yes.
Let's jump into this. Let's talk about vitamin E.
What is vitamin E? Vitamin E is an antioxidant.
It's the most potent antioxidant we have.
Yes, and
Natural antioxidant.
I feel like antioxidant is one of those like superfood terms that they're like, oh, this is like rich in antioxidants. And you ask your average person, what's an antioxidant? They don't know what that means.
I think that if we're going to understand an antioxidant, we have to understand the concept of the free radical.
Yes.
This is the easiest way I can explain this. If you've ever watched the movie Men in Black, Will Smith comes in, and he's first inside there, right? And he bumps into that little ball, and it starts flying around the office, tearing everything up. That's a free radical.
That's a really good metaphor for it. Yes, I like that.
If there's a way to put that into the podcast, that would be awesome.
I don't know if we're going to get, if Warner Brothers is going to come after us or something.
And I'll tell you this, if you haven't seen Men in Black, you should watch it, just to understand that part. And then the greatest way I know to explain vitamin E is Tommy Lee Jones puts on this glove, right? And he like catches that little ball. All right, that's vitamin E. So free radicals, they like run around tearing up the body. They're a byproduct of normal everyday living and metabolism.
Yes.
We produce these lone electrons or these reactive oxygen species. Just know they're unstable compounds bounce around tearing the world up. And you got to have something to counteract those.
Yes. And so what these antioxidants do on kind of a micro level is they're giving out their electrons. They got electrons for days and they're giving them out. And they're restabilizing these other molecules that are going around and, you know, wrecking havoc on everything.
Yep.
And, you know, kind of a part of that with vitamin E is our antioxidant. You have to have a way to recycle that vitamin E. So that's where selenium comes into play.
Yep.
So selenium is kind of it gives these electrons back to vitamin E. So one of the things we're going to talk about, and we get into this podcast, is how these two kind of work in conjunction together. How a lot of our sources, we need to have both of them.
Correct.
To be successful.
And the location of them, too, because that's one of the things we talk about. Vitamin E is going to be found in the cell wall of the cell. And selenium is going to be focused more on the cytosol. That's that liquid portion inside the cell is where it likes to hang out also. So it's really, really cool. I love vitamin E.
And it's an essential vitamin. It's not something that the body can make itself. So we have to supplement it to ourselves and to horses.
Yes. And the only source of vitamin E in a horse's diet has to be fresh green grass.
Yes.
That is it.
And that's the problem.
The first nutrient that leaves when you cut hay is vitamin E. Mm-hmm. Like that hay hits the ground, and vitamin E is just gone. It's disappeared. This stuff it disappears very, very rapidly. So it becomes very, very important to supplement in most cases.
Yes, it does.
So we'll get into that, but let's talk about fat-soluble vitamins.
Yes.
One of the things we need to understand, there's two different kinds. There's fat-soluble and water-soluble. You always hear about vitamin C. That's a water-soluble vitamin. That means the body doesn't really store it all that well. Whereas a fat-soluble vitamin can be stored in body tissues, in fat. And that's really your two big differences.
Yes. But when we get into talking about it, is the fat-soluble vitamins is how bioavailable is it?
Yes.
And that's where it comes in. The body can store it well, but we have an issue getting it available to us in the first place.
Correct.
Which is where, when we get into vitamin E, we talk about how not all vitamin E supplements are created equal.
Yes.
And it's all about how much actually gets to you.
Correct. So that's the bioavailability part, because if the body can't absorb it, then it definitely can't store it and it can't utilize it. So bioavailability becomes very, very important.
Yes.
And that's really all micronutrients. I don't want to get into that, but we run into that with minerals as well. Some minerals are bioavailable, some aren't.
Right.
Some forms, I should say, forms.
Yes.
So the form of vitamin E, the form of these minerals, the form of the vitamin becomes very, very important.
Yes.
So we're gonna dive into that as well. So let's talk about the NRC recommendations. How much of this do you need?
So vitamin E kind of works in its own little fun units. They're called international units. I don't know the exact breakdown of that. But it's 1 to 2 international units per kilogram of body weight per day. So for a 500 kilogram horse,
1,200 pounds.
1,200, yeah. So 1,200 pounds of horse, we're looking at about, 1,000 international units per day. There is a big range with this, though. We can safely go up to 10,000 international units per day in a horse.
Well, I think that's important to talk about, is that's what it takes for the horse just to survive.
Yes.
What
just
we call
to live.
maintenance.
Yes.
We know that if as horses increase in their exercise or during pregnancy, anything that has a higher metabolic demand, we're asking more out of the body than just walk around and eat and do nothing.
Right.
We know that demand for vitamin E goes up. And that mainly is because the more we exercise, the more metabolic activity we have, the more free radicals we produce, and the more we need that antioxidant capability.
Yes.
So when we talk about most NRC requirements, they're based on just living.
Just living and breathing and eating.
So the higher the performance of the horse, the higher that need is. So when we're talking about athletes, they have a much higher demand than that typical 1 to 2 IUs per kg that the NRC recommends.
And where we, kind of mentioned earlier, the best natural source of this is fresh green grass.
Right.
But you have to look at where that grass is growing and the soil of that. And it's supposed to be that we here in Georgia, we actually have probably better vitamin E in our soil compared to other places, correct? Is that?
Well, our grass is produced, and I think it just has to do with the growing season. We have a longer growing season. We can grow grass we can grow grass all year. And a lot of places can't do that, depending on, especially in this area, because we can have cool season grasses that grow in the wintertime, such as fescues, and then we can have warm season grasses, such as Bermudas, that grow in the summer. When you get into areas like where you're from, you'll have this white stuff that shows up, snow. We don't like to say that down here.
The blizzard.
Grass doesn't grow in snow.
No, it does not.
And so I think that's a lot of it is we have that longer growing season. We're able to grow more. We would have that grass year round if we really wanted to. We can even go in and plant ryegrasses that'll grow all winter. So we can do things down here that a lot of places can't.
Right.
So we have a good growing season. We can have that vitamin E in the plant.
But again, even having that fresh pasture, that may not suit a specific type of horse's needs.
Correct.
If they're on a maintenance dose and maybe that's all they need, that's fine. But again, if we have a broodmare and they're trying to grow a fetus, or we have, an athlete,
right,
or we get into a horse that has neurologic disease, which we'll dive into in a little bit later in this episode,
right,
they need a lot of vitamin E.
So we need quite a bit of it. And then, the other thing, when we look at the management of most of our horses, I mean, how many horses do we have anymore that are able to be out on pasture 24 hours a day?
Right.
It's not suitable in most conditions. They may have turnout into paddocks, they may have turnout into pastures, but it's typically not an all-day scenario. And even if so, they're often still not grazing enough to meet the demands of being an athlete or a broodmare.
Right.
So supplementation becomes really important.
Yes. And there we get into the types of supplements.
Yes.
And there's a lot of vitamin E supplements out there.
Yes.
When I was researching this episode, I just started looking into see, and I'm like, oh man, there's a lot.
So getting into that, when we start talking about that vitamin E, natural is always best. And this is why we had to take organic chemistry. If you remember back, we had to take organic chemistry to be vets, and we had to learn about D's and L's.
Yes.
Dextro and levo. And that has to do with, did you make a right-handed molecule or a left-handed molecule?
Best way to describe it.
Yes. And basically that means one's active, one's not. Nature typically only makes, those are called enantiomers. Nature typically only makes one. Easiest way to tell if you're dealing with a natural or a synthetic is whether it's a D, L, or a mix of both.
Yes.
So when you see that DL, and we should probably talk about this, the nerd name for vitamin E. The nerd name, alpha tocopherol.
Tocopherol, yep.
So, and then the D and the L are very important.
Yes. The D is considered the most natural. That is the active one. That is the one that is working. It is only one isomer, and that is your purest form.
Yes, D-alpha tocopherol is what we want.
The problem is when you get into creating, you have your natural and then you have your synthetics. So natural is the D. Synthetic is going to be D and L, or a mixture of those. Yes, usually a combination of both. One of the things I looked at is the synthetic versions of it. You have 8 different isomers that are basically floating around in this. Only one of those is working at a time. Versus in the natural sources, there's only the one.
Correct.
That's all you've got. So that's where a lot of the price discrepancy comes in. So, the kind of argument for the synthetic ones is that you are going to see they're going to be cheaper. They're a little more available for people to just go and buy, but these are also more shelf stable. These ones last a lot longer compared to the natural ones.
Yeah, the downside to that, though, is it may last longer. It may be cheaper to make, but it's not doing anything.
Correct. Because again, you only got 1 out of 8 that are working. So
and they don't tell you like you've got, all right, there's 8 isomers in here, and they can't tell you like 50% are D's, 10%. Every time they make a batch of this, it's going to vary.
Yes, that's true. That's true as well.
So we don't know how much when we see that synthetic. So if you see, like I said, the easiest way to see it, if it says DL in the front of the alpha tocopherol, D and L, it's synthetic. The problem is we have no idea how much D, how much L, how many of these isomers are in there, which ones are there, at what level. We have no idea what's in that bottle or what's in that jug, like in the tub. So the simplest way to think about this is when you're looking, step 1, D alpha tocopherol. Make sure it says only D.
Yes.
Natural sourced D. The others, you're wasting your money, you're wasting your time. It's doing absolutely nothing to help us. So make sure it has the D.
Yes.
The next one we can actually, so when we're talking about that, we have the D. Now we have to keep this molecule stable. Again, highly unstable molecule. Highly unstable. 2 different ways we can make it stable. We can micelize it, which is a cool way of saying we encapsulate it with fat, or we can esterify it.
Yes. So we'll talk about the little encapsulation one. That's my personal favorite. I like it. That one. I watched the whole video of how they do it, and I was like, "Ooh, this is fun."
It's kind of cool.
It is pretty cool. I was like, "Oh, this is pretty neat." Like I didn't actually know that all the process that went into it. So remember when we talk about fat soluble vitamins, The best way to think about this is if you mix oil and water, or you try to, they're not going to mix.
Nope.
They don't like each other. Oil is something called hydrophobic. It doesn't like water. It doesn't play well with it. And that's where vitamin E is living. It doesn't want to mix with water. But in order for us to get it into our bloodstream and thus get it to the rest of the tissues, we have to create something that is water soluble. So what they do is they basically take these vitamin E molecules and they put a little capsule around them with these structures called liposomes that are attractive to water. They're hydrophilic. And this allows that vitamin to basically get absorbed into the bloodstream and then thus travel wherever it needs to go. That's the simplest way to put it.
Yeah, it's kind of cool because it basically forms like its own protective candy shell around
Yes.
it. So it's
Yes.
got one end of that molecule that is has high affinity for fat or where the vitamin E lives. The other end of that molecule loves water. It's kind of like your go-between.
Yeah, and then once it reaches that water, it breaks up.
Correct.
It breaks up, and now we have the free-floating vitamin E, and it can get to wherever it needs to go.
And it's protected from the water, but at the same time, it's dispersed, and it's almost like when you buy, if you ever see milk coming out of a cow, the cream floats to the top.
Yes.
They actually go in and break those particles up and micelize them and break all those up so that when you buy your gallon of milk at the store, that fat, that cream that's in there has been dispersed throughout the entire gallon of milk. It's not just floating on top. And so it's the same kind of
Yes.
very similar process.
Yes. So our one product that we use pretty regularly here that does that is a product called Nano E.
Yes.
Well, we love Nano E.
Love Nano E.
Big fan of Nano E. Please sponsor us.
KR, if you're
Please
listening. No, we're big fans of Nano E.
Yes.
It is a liquid form. It is extremely bioavailable.
Yes.
And your biggest thing is, well, we'll get into that later when we talk about neuro, but yeah, it's highly available and it's a great, fantastic product.
We love Nano E.
So the other way we can do this is we can esterify it.
Yes.
Yes, let's talk about that.
So, again, we talk about vitamin E being very unstable, so we need to mix it with an acid molecule in order to prevent it from just completely denaturing once it hits the bloodstream. And so we give it a little friend, and that friend's name is acetate. And basically, this friend just kind of holds its hand while it's going through, and it'll keeps it from getting broken down like right away when we get into the the digestive tract, and that way it actually has an opportunity to get absorbed and get used. Our best one that we use is a drug called Elevate.
Yes.
We love Elevate.
So the acetated form, if you think about it, like it's holding its hand, but then when it gets to where it's going, it's like, go be free. Go do what you're meant to do, vitamin E.
It's an emotional support.
Yes, it's truly an emotional support
Emotional
molecule.
support acetate, so.
Yes, good job, acetate. Thanks for emotionally supporting our vitamin E. So yeah, the esterified form, the most common one, like I said, we like is the Elevate E product. So and it's in a powdered form.
It is a powder, yep.
So one's Nano E is a liquid, Elevate is a powdered form of vitamin E. We use both of them.
Yeah.
A lot of times we'll talk about when we pick one over the other, but Elevate being a powder does make it a lot simpler to use in day-to-day operations.
I think it's a little more shelf stable too. I think compared to just how long you can keep it before it goes bad. But they're both great products. Like when we kind of get into talking about horses that need vitamin E and when we're treating them, and we kind of say, well, which one's best? Honestly, I'm like, either one, you're good to go. But these ones that you can just, find on Amazon or, pick up at the feed store, these don't have these processes done.
Right.
Because they are the synthetic form, because they have a mixture of everything.
Well, when you start dealing with these natural source and you start looking at the processes it takes to stabilize this molecule, these are not easy to do.
No.
So unfortunately, they are more expensive.
Yes.
But one of the things I always like to say is the most expensive medication is the one that doesn't work.
Yes.
It's the same thing when you're dealing with nutrition and you're dealing with these micronutrients, especially. Like, there are always cheaper forms. But if they don't work, then now you've wasted money.
It's like you've made expensive poop.
Yes.
I think we've said that many times on
Made
this
expensive
podcast
food.
that a lot of these supplements are just expensive poop.
Yes. So when you're really looking at it, the two products we really like I said, the Nano E and we like the Elevate E. Mm-hmm. Both those work great. They're not the same company. They're two different companies, but it's really important to use a quality vitamin E product when you're supplementing. I can tell you over the years, I've had horses that a new product to come out and said, we're the same as, and they're less.
Yes.
And people will swap over to them. Then they come back in, and I'm like, what's changed? This horse, because there'll be a horse that we'll talk about later has like a vitamin E deficient myopathy, and all of a sudden they come in, their muscle doesn't look good. They're not healthy. Like something's off. And then you find out, like, oh, we switched over to this other vitamin E. It's supposed to be the exact same. And I was like, well, it's obviously not. And so then it's like, okay, what do we
need to do?
What do we need to do? Mm-hmm. We need to get back on the good stuff.
Yes.
So not just from a nerve perspective, but clinically, we can see differences when people swap off these products.
Yes, we can.
So
yes, we can, and it can happen pretty quickly too.
Yes.
So that change, like within a couple weeks, you can see that change.
So if you still listen and we haven't bored you to death with all the nerd stuff on vitamin E, if you want the key takeaway here, Nano E, Elevate E.
Yes.
That's your key takeaways. So let's talk about how we kind of figure out let's talk about when we have problems with vitamin E.
Yes.
Let's talk about things that are related to vitamin E.
Yes. Most of the problems we're seeing with vitamin E in horses are related to vitamin E deficiency.
Yes.
Vitamin E overdoses is a thing. It's not very common in horses.
I haven't seen it yet.
Maybe in horses that they are just pounding vitamin E into for laboratory purposes, but the most common thing that we are seeing is all related to vitamin E deficiency.
Yes.
And it gets a little tricky because it's not exactly a black and white thing when we talk about kind of these big diseases that deal with vitamin E deficiency. A lot of them are due to kind of current vitamin E deficiencies, but a lot of them we've found that they're due to vitamin E deficiencies when they were young and growing mm-hmm. and getting a lot of foundation. Some of them we even suspect it had to do when they were in utero, and
yes.
It's because the mare wasn't getting enough vitamin E, and it's leading to these developmental things. There's also some genetic predispositions to things, like you might have horses that are in the exact same environment and eating the exact same food and doing all these things, and one horse looks great and the other horse doesn't. And it's because this one horse with this kind of genetic predisposition to it didn't get enough vitamin E, but they're the ones showing signs.
Correct.
Even though the other horse also isn't getting enough.
And it's been speculated, and I know they're trying to do some work on this. We're not sure if some of these horses do not absorb vitamin E like they should, or if they're not absorbing it through the GI tract and storing it the way they should, or do they burn through it more rapidly than mm-hmm. other horses? Do they have a higher oxidative stress for whatever reason? And it can be two horses doing the exact same thing, eating the exact same diet. One's deficient, one's not. And we're not sure if they just have a higher demand for it, so they're using it more rapidly, or they're not able to absorb it like they should.
Right.
And so hopefully one day we'll figure that out.
Yeah, kind of find that link of what exactly it is. And that might help us again with treating it, because
yes.
if it's a matter of, just getting it to them, maybe some of the nerds in the chemistry department can figure out how to make that even better. So let's talk a little bit about these conditions and what they look like. Let's talk about a very common we run into is these vitamin E deficient myopathies, yes.
or vitamin E storage myopathy. And in very severe cases, there's conditions such as Equine Motor Neuron Disease that have been linked to vitamin E deficiencies that we suspect may have occurred, like I said, either in utero or as this foal's developing.
Yeah. So we'll get into the I guess I don't want to say happy one, but it's the one that we can fix a little better. The vitamin E responsive myopathies. So these horses usually present to us and they have severe muscle wasting, They're dumpy. They're very weak. A lot of them, they come to us for just kind of generalized performance issues. In some severe cases, they can come and they're just very like twitchy. They have these
Right.
muscle fasciculations. These guys, in the name, it comes with vitamin E responsive myopathy. It's usually due to they are not getting enough vitamin E. And we think this is one of the ones that it may be an issue with storing it.
Correct.
So the way that we diagnose this is through a muscle biopsy.
Yes. One of the things that we're talking about, like you said, you've got that muscle wasting, and some of them will actually have muscle, but if it's what I like to call a poor quality.
Yes.
Like when you visually look at them, you don't really see a necessary lack of muscle, but when you lay your hands on them, they don't.
It's like squishy.
It's
almost.
squishy.
It's like squishy muscle. Yeah.
Yes. And the riders describe them as being almost weak.
Yes.
Like they should not be struggling with, whatever they're trying to do, but they feel like it's a struggle. Mm-hmm. And you're looking at them, you're like, you don't look like it's an issue, but then you start laying your hands on them and you're like, you're really squishy. Mm-hmm. Like your muscle's it's not healthy muscle.
It's not doing it what it's supposed to do.
Right. Mm-hmm. And I think that's the early stage.
Yes.
And then later on it becomes like, wow, where's your muscle at? Mm-hmm. It just disappears.
Yes.
So yeah, the best way to get this diagnosed is that muscle biopsy. Mm-hmm. We take a sample from a muscle called the sacrocaudalis.
Yes.
It's a little incision up by the tail head. It's not scary. We go in and get a little bitty sample. We send it off to the lab. They look at it under a slide. They have some specialized staining techniques, some things they look for. It comes back vitamin E deficient myopathy, mm-hmm. and that's how we find it.
Yes. And the muscle biopsy is really important for this. One of the big questions we get is, well, why can't we just do a blood test?
Yeah.
And one of the issues that comes with vitamin E is kind of what we've talked about a couple times, is that vitamin E is a very unstable little molecule. There was a study done in the 80s, all the way back, and they looked at horses about looking at their serum vitamin E over a 72-hour period, no change. They were on the same diet, like they're just kind of out there living. There's a ton of fluctuation in these horses throughout the day.
That's what we found. I was working for this, doing a consulting project for a big breeding farm up north, and we had a known vitamin E issue in our foals. In foals, they get a condition called white muscle disease. Mm-hmm. And what that leads to is they're dysphagic or they have trouble swallowing.
Yes.
So these foals don't, they're trying to drink milk and it actually ends up in their trachea because they're not able to swallow like they should. And that goes back to a vitamin E or selenium deficiency. And so we're trying to run this down. I mean, when I say we were pulling vitamin E samples, I mean, we're talking hundreds of samples. And we weren't able to really gather any information from it because it can fluctuate by day.
Yeah.
It can fluctuate during the day. So depending on when you pull that sample, all it does is tells you what the vitamin E concentration is in the blood.
In that moment.
And then that moment.
Right.
10 minutes later, it may be different.
And we kind of have cutoffs that the lab has established, but if you don't know where this horse lives, kind of on a day-to-day basis, then you don't know. And it's, I mean, it has been shown to, they have horses where they're living, and then you put them on a vitamin E supplement, and you do see changes. But again,
Right.
It's so individual per horse that if you've never run vitamin E on this horse before and you just pull one randomly, it might look completely fine, even though they have this storage myopathy going on.
And then the other part that makes this tricky too is we've yet to be able to correlate serum vitamin E levels to what they are in tissue, whether that
Yes.
be muscle or neural tissue. There's been multiple studies done and we haven't been able to correlate, like, okay, if we have a vitamin E level of X inside the blood, then it's Y inside the muscle or Y inside of the neural tissue. There's we haven't been able to come up with a correlation yet.
Right.
So, and I can't remember the last time I've now pulled a vitamin E because it doesn't help me.
No, it doesn't.
So I don't do it because I don't.
I feel like it was really trendy like a couple years ago. Like
Yep.
we had a lot of people asking us to pull it, and I'm like, I never got anything of value.
No, and like I said,
out of it.
I had a control group of 30 mares, and we're pulling it on these mares before they foal. We're pulling it on at the time they fold. We're pulling vitamin E levels on the foals, on weanlings. I mean, we're pulling it constantly, like at least once a month. And so we batched all this, and like it really.
Yeah. It's not helpful.
No, basically the data agreed with every study out there.
Yep.
That it just doesn't help. So
Right.
Again, that testing of the blood really doesn't help us. If you want to know if your horse has this, 100% you've got to have a muscle biopsy of that sacrocaudalis.
Yes.
That's the muscle we find this in.
Yes. And why we like this one is treatment is you put them on vitamin E.
Yep, stupid high doses of vitamin E, and they get better.
They get amazing.
Yes.
I mean, like, it's like night and day, some of these horses.
It is really, really cool how fast they turn around and how much better they look. Like, usually within, like, I remember the coolest one I ever had, it was one of the things that this vitamin storage myopathy can lead to are behavior problems. And so these horses can have abnormal behaviors. And I had this horse that it was one of the first ones I tested. We're going back, let's just say a long time ago.
I was like, "You're careful, Dan.
I know.
You're about to age yourself."
I'm now that guy that gets to say, like, it was longer than 10 years ago. Like, I've now become that guy. But it was greater than 10 years ago. And I remember they were done with this horse. Like, it just wasn't fun to ride. It was having a lot of issues. It wasn't being successful. I got the biopsy back. Vitamin E deficient myopathy. The horse was actually up at Brownland in Tennessee showing. And I was like, this is what we got. We need to get some vitamin E. And a good friend of mine was working at the show. He was the show vet. And I called him up and I was like, hey, Monty, you got some vitamin E? He's like, yeah. I was like, can you get it over to this customer? And he's like, absolutely, on the way. I got a call 48 hours later and ecstatic.
Wow.
It worked that quick on this horse.
Wow.
Now, that's not every time.
Yeah. I was going to say, I was like, normally it's like a couple weeks to months
Yes.
so that we're seeing changes, but
that one had a behavior change like at the show. Like got it like on Thursday of the show. By Saturday, it was a big enough difference. They called me and they're like, "Dan, this is amazing.
Wow.
We love this horse now." Mm-hmm. And they were to the point. I'm pretty sure if somebody would have just taken the horse, they'd have given it away. That's how
it was that
frustrated
bad.
they were.
Wow.
Got the test result, knew what we were going after, started the treatment, and boom. Here we are.
That's amazing.
It was really cool.
That's crazy.
Yeah, it was really
yeah.
cool. Let's talk about the one that's not so fun, and
Yeah.
this is Equine Motor Neuron Disease.
Yeah. So this one is Equine Motor Neuron Disease, or EMND. There's going to be a lot of acronyms in this section of the podcast. So this is kind of specifically describing these adult horses that have a vitamin E deficiency. And these guys have just severe muscle dysfunction. And it usually has to do with these neurons that are just completely falling apart within these muscles, within these kind of muscular junctions. This is another one of these ones. It's not black and white. We know that there's a genetic component to this, and there's a lot of different factors that go into it, but the kind of overarching trigger is that these horses have low vitamin E.
And it's the low vitamin E in the neural tissue itself. So we talk about the storage myopathy. That has to do with muscle tissue levels of vitamin E. This one, we're going to deal with the actual neuron going to the muscle. Mm-hmm. So you have neurons that are in the spinal cord, or what we call the central nervous system. Those are going to synapse or connect with another nerve that goes out into the periphery of the body. And that's the nerve we're talking about, the one that's actually out into the body, going to the actual muscle group. And that's the one with equine motor neuron disease that we see this deficiency, and we see the side effects from having this deficiency in the neuron.
And these horses, they can look like anything. I mean, they can look like just really poor doers. Like, I mean, they can look very emaciated, like poor muscle quality. We've had some that present with like really severe behavior issues. Yes. Like, I mean, we're talking like severe just reactivity. A lot of them are they're very sensitive, and they just kind of explode almost.
Right, it just almost comes out of nowhere. Like they're going to be fine one day, and the next day it's like the most common thing I hear from people is it's like he checks out.
Yeah.
They're like the horse just checks out. Like there's like no regard to safety, no regard to anything. They just check out and lose their mind.
And this is another one. The kind of best way to diagnose this is a muscle biopsy.
Right.
Because we actually see those changes in the neuromuscular junctions. Yes, thank you. I'm like, again, this is a lot of neuro for 8 in, so.
Yeah, and these guys a lot of times have generalized weakness as well. They're just they're weak. And we used to always think equine motor neuron disease, that was a condition of foals. We're not going to see it in adult horses. Turns out we will see it as well.
Yes, and this is, I think the kind of key age for this is like kind of teens is where it really starts to show up, and again, this is one of these ones that we're really, now that we're doing a lot more muscle biopsies, we're kind of able to identify this and, characterize it a little better. And there's some question as to like, is this like a lifelong change that's happened? Is it just because they've had recent changes that have happened? Was it something that, they were predisposed to because their mare wasn't getting enough vitamin E? And
this is going to be pure speculation. So again, this is theory according to Dan, but and hopefully we'll get this sorted out. But my guess is a lot of these equine motor neuron disease horses, I think the mares were deficient in vitamin E. So when that neural tissue was developing, because neural tissue has a high demand for vitamin E.
Yes, it does.
Neural tissue does not like oxidative stress. It does not function well at all in that environment. So it has a high need for vitamin E. I think when you have these mares that are deficient during pregnancy, and then these foals, they're then born deficient, and then are raised in environments where they are also deficient. Because vitamin E is passed in milk. We do think there is some concern that they did not get it during the development, during that in utero development, and then that development as a foal, and then the growing phases of being a foal, a weanling, a yearling. I think that can definitely set us up for this issue.
And again, then it's not even showing until they're
later on,
and maybe they're well established in their job, or that's why this one's kind of depressing.
It really is. Thankfully, we don't see it near as much as we see the vitamin E responsive myopathies.
Right.
But boy, when you get this one, it's a heartbreaker.
It's kind of long-term prognosis with this. There's kind of a couple different paths they go down. There's the stats that I found was that 20% of them can live and be fine, but they just look horrible. They're just extremely emaciated looking and very weak. 40% of them will just progressively deteriorate, and they end up having to usually humanely euthanize these guys because they're just so weak and miserable. They said that 40% of them can improve with some lifestyle changes. So with like really, really high vitamin E supplementation, that they can still go into some level of work. Most of the time it's not the level of work that they were doing before that. But a lot of them will end up relapsing as well, is kind of the sad part of this. So this is not one that we like to find. But again, luckily it's not as common as the responsive ones.
Correct.
But, I'm hoping, again, like with kind of figuring this out, now that we are testing more for it, we can find some patterns. And
there's a lot of people that are doing work on this now, and we're hoping to really be able to overcome this condition. And I think your biggest thing is if you're in the breeding business, make sure that we have. I can tell you the one farm I can still consult for, we supplement. It's up in the north. They have that white stuff, so they get very little grass. We supplement the heck out of vitamin E, and it'd be really cool. I really need to get it out there, but like looking at the data and looking at even just the quality of horses we're raising now compared to 8-9 years ago when I first started, if you could see the difference in what we were raising compared to what we're raising now, it is night and day difference.
Oh yeah.
In the horses, and I attribute a lot of it to the vitamin E supplementation. I mean, they are religious about it. I mean, it is
good vitamin E supplementation.
Good vitamin E. I mean,
Yes.
we're bringing in Elevate by the pallet, I think. I mean, it is like, wish we could get a bigger load of it. So, yeah, I think it makes a huge difference.
Yes.
In that in utero. That's a lot of where my theory was, that I think this is an in utero problem and a development problem, because I had a lot of horses that, when we really kind of looked at them, if we could track them out far enough, I really wonder if how many of those horses we were raising at that time were having
issues, yeah.
having this issue. So the next one, this one, thankfully we don't see it a ton. This is a true heartbreaker. This is the equine neuroaxonal deficiency.
Yep.
Another name's the equine degenerative myeloencephalopathy. It just depends on the location of where this is at.
Yep.
EDM is awful.
Ugh.
Awful.
I've never seen it, but I hope to never see it. But
I have seen it more than I would like. A lot of European warm bloods. There was a stat presented at AEP that, if you look at imported European warm bloods, 25% of them with neurologic signs were actually EDM.
Really?
Yes.
Wow.
I remember sitting in a AEP lecture, and that data was presented, and it was quite terrifying.
Ugh.
And that's typically where I've seen it is imported horses.
Interesting.
And again, this is hitting that 8 to 12-year-old population right at the peak of these horses' careers, doing fantastic, and then it is a crash.
Yeah.
It's usually first, again, we kind of see it with this behavior problems. I mean, when you say these horses check out, they check out. I mean, I've seen people going around a jump course, life is good, and then next thing you know, this horse is bucking, headed for a fence, and just no control whatsoever. Lights are on, nobody's home, just check out. It's truly a really devastating condition.
Yeah.
We'll start to see some of the very similar things where they're going to have more upper motor neuron deficits. So that means this can look a lot like EPM. It can look a lot like a wobblers or a cervical compression, where they have more of the upper motor neuron or brain and spinal cord component to the neurologic evaluation. And you kind of have to sort through. You start doing a lot of testing on these. Unfortunately, the only way we can actually diagnose this one is post-mortem.
Yeah.
So on a necropsy after we've euthanized.
Yep.
And that's the most horrifying thing, is I can't get you a diagnosis of this while your horse is alive.
But and this is one of these ones where, again, we do have to, it can look like a lot of things, so we have to start checking boxes. So, like you said, EPM, that's something we can rule out pre-mortem. The wobblers or the cervical compression, we're taking x-rays of these guys' cervical spine.
Yeah, we're taking x-rays. Usually they've also had, I do a lot of CT myelograms. I do have a lot of CT myelograms done on these, because that is the gold standard if you're going to get it diagnosed. If I'm not seeing evidence of it radiographically, we're going to go ahead and do that CT myelogram. That horse, usually what happens is you've done a CT myelogram, they're negative. No signs of wobblers. You've done an EPM test, no diagnosis of EPM. You're still having these issues, and that's, unfortunately, now we're down to, and usually we do a muscle biopsy as well to rule out the Equine Motor Neuron Disease, the vitamin E responsive myopathies, any of these other neuromuscular conditions. And so we've basically ruled everything else out that can cause these symptoms.
Yep.
And we're left with EDM.
Yep.
So, and then we have to make the decision.
Yeah.
And I always say it's the most terrifying 2 to 3 weeks of my life, because we've euthanized this horse. The pathologist is doing their job, and it sounds bad, but you really hope they find this on the slides. Because if we can find it, then we all know we made the right decision.
Right, yeah.
I've been very fortunate, the ones I've worked up, when we've suspected this, that has been the case. So.
And this is another one of these ones that we think there's a lot of different factors that go into this, but the vitamin E is kind of the most consistent thing that we find in this.
And we really think that's, again, going back to that in utero development when these horses are young, when they're nursing, weaning, yearlings, we think that's when a lot of this gets set up.
Mm-hmm.
So, again, we've got some nerds really looking into it, but it's a really horrible condition. And like I said, the hardest part is you've imported these horses or you buy one of these imports, they're in the prime of their career. And like a lot of times you see nothing on the pre-purchase. We've had them anywhere from 6 months. We may have had them for 2 years. And these behaviors start showing up. These clinical signs start showing up. And it's right when this horse ought to be in the prime of its career.
Mm-hmm.
And we go downhill. So it's definitely a buzzkill.
Yes, that one is kind of a buzzkill.
Yes, that's not a good one.
I don't like the ending on that, but
yeah. But I think, bottom line, if I was really looking at what all we've talked about, and we've kind of skimmed the surface here on vitamin E, is understand that it is really important.
yes,
Like, yes, it's a micronutrient, but it's a micronutrient because of the level, not because of the importance.
Mm-hmm.
This is a very, very important vitamin in your horse's diet.
yes. And if you're, listening to this and you say, well, how do I know if my horse needs vitamin E supplementation? Talk to your vet.
Yes.
And we'll look at kind of everything. We'll look at what kind of performance are we doing? Are we, just our weekend warrior trail riders? Are we, showing every other weekend? What's our living situation? Are we on a dry lot? Do we have endless pasture? Do we have snow on the ground? There's a lot of different factors that go into this, and we'll kind of talk about what does your horse need, and what can we reasonably do for your horse. Again, this is one of these essential nutrients. Your horse can't really get it themselves; they can't make it, so we do have to supplement to them some way. But not all supplements are created equal.
Yeah, if I had to, when in doubt, supplement.
Yes.
Because that's one of the things, like, just understand, like, your hay, no vitamin E in hay.
Mm-hmm.
And most feed sources, if you look, they're going to be using more of the synthetic vitamin E's. And even if they're not, again, we've talked about how unstable this molecule is. So it's been added to the feed, and the feed's sat in the truck, sat in shelves, it's sat in your barn. Like, by the time it gets there, the amount of, available vitamin E in that feed is really, I always say I don't even consider it there.
Yeah.
I say pretend like that vitamin E doesn't exist. And even if it does, it's in such small quantity, it's not going to be providing the need for your horse. So I'm a big proponent of supplementing.
Yeah. And this is not a supplement-based podcast. Like,
no.
we've kind of crapped on supplements a lot, but this is the one that we're like, if you're going to pick one thing to supplement, this is the thing you supplement.
This is it.
Like,
high quality vitamin E.
Yes.
If you, and really to keep it really, I tell people all the time, like, I can nerd forever on this. If you want to know the simplicity form, you want to use Nano E or Elevate E. That's your two big things. I'm not here promoting a product. I wish I got sponsored by them, but we don't. We got no sponsors, so we're just telling you the truth. So, and one thing I do want to say too about the Nano E, this is very, very important because I get asked this a lot. If you're going to use Nano E in the liquid form, when you pull it up, you need to put it directly on the feed and make sure they consume it right then, or you need to syringe it to them. It cannot sit around for hours.
Nope.
Just hanging out.
Nope.
It needs to go directly in because, again, it's micellized, it's protected, but that protection only lasts for so long. The other thing is people are always asking, why don't they make a bigger bottle? Well, that has to do with how fast you can go through it. So you'll see a lot of these products are in the big gallon jugs. They're constantly opening and exposing that vitamin E to air. When we talk about it oxidizing, that means it's exposed to this reactive oxygen that's also floating around. That's going to degrade your vitamin E. So that's why the container is smaller like it is, because these big gallon jugs, you can't go through it fast enough. So at first it may be very stable, and then as we go through it, it's less and less stable.
Yep.
So if you're going to use Nano E, make sure you use it correctly.
Yes. Yes.
Storage is important on both of these. If you look on most things, it'll have a temperature range at which it should be stored. Store it there. Don't just say, oh, it'd be better in the fridge. Not
No,
necessarily.
it doesn't. This one doesn't like getting hot either.
Doesn't like getting hot. Doesn't like getting cold. It's a true Goldilocks. It's a little bit of a diva of a vitamin. It wants to live like in my optimal range. So make sure you read the bottles and know how to store it.
Yes. Yes.
So,
All right. Well, we ended up on a little bit better of a.
yeah, key takeaways: vitamin E, supplement it. It's good.
It's a good one, but you have to pick the right one.
Pick the right one. If you're concerned about these things, talk to your vet.
Yes.
Don't guess your way through, because the other thing we didn't really mention was vitamin E storage myopathy can look like a lot of other neuromuscular conditions as well. So don't just assume this is what your horse has. Get the answer.
Yes.
Like, if diagnostics are important, knowing what you're dealing with is important. So make sure you're talking to your vet, find out what you need to do. So, well, appreciate everybody listening in this week. Like I said, we kind of got a little in the organic chemistry realm, a little bit of the nerd realm, but that's kind of where I like to live.
Yeah, it's a fun one. We've got some podcast coming up with some more kind of neuro and neuromuscular based things. So this is kind of our intro, because vitamin E is going to come up a lot in those.
We're going to talk a lot about vitamin E.
Yeah, vitamin E is a key player in a lot of these future podcasts. So we kind of wanted to introduce some vitamin E to everybody, and so make it a little less scary and a little less confusing.
So when in doubt, supplement vitamin E.
Yes.
But make sure you're talking to your vet to figure out what you need to do. Use the right forms. It's very, very critical. Don't use the ones that don't work.
Yeah.
There's no point in that.
Expensive poop.
Yes. So thank y'all for listening. Hope y'all learned something. Dr. Brown, thanks for being here today. April, thanks for recording this. Casey, thanks for editing it. And to all the staff here at Countryside Equine, thanks for helping make this all possible. So hope everybody's having a great day. Y'all take care. Thanks.
Bye.